Hello and welcome. I'm Luis Rosero, Deputy Assistant Secretary for Public Affairs here at HHS, and welcome to our fourth web chat on health reform. We host these web chats because we understand that some of the details of the Health Reform Act can be confusing, so we're here to answer your questions. Earlier this week, we invited you all to submit questions about health reform, and today we're going to address as many of those as we can. We'll keep the door open for additional questions during the web chat in case someone needs clarification. You can email us at healthreform@hhs.gov or send us a tweet on Twitter. Our handle is @HHSGov. We'll be holding these conversations regularly in the months ahead, so if we don't get to your question today, we'll make every effort to cover it next time. Also, keep in mind that we'll also be answering some of the most frequently asked questions each day on our website, healthreform.gov, so check the site regularly for more information and updates. We receive many questions from seniors, for seniors, or about seniors. With that, we're going to focus today on questions regarding, you guessed it, seniors. Joining me today are the consummate experts for all things senior-related. Kathy Greenlee, the Assistant Secretary for Aging at HHS.
Hello.
Jonathan Blum, the Deputy Administrator and Director of the Center for Medicare at the Center for Medicare and Medicaid at HHS. And a very special welcome to Jennie Hansen, the President of AARP.
Okay.
Welcome. Kathy, bring us up to speed. There's lots of things going on here at HHS and Aging. Tell us what we're doing.
Well, health reform is so comprehensive, and clearly the American people are watching and listening and asking questions. What we're wanting to do today and in general is talk to older Americans, which is a very broad range of people, and talk about the issues that people age 50 to 64 have, as well as people 65 and older who are on Medicare. They have different questions and they have different needs and answers, and we're wanting to provide good information about what they can expect and the decisions that they will have in the future.
Thank you. It sounds very exciting. John, what are some of the key points that CMS is currently addressing?
Well, the law makes many changes both to the Medicare program and to the Medicaid program. For the Medicare program, the new law makes Medicare stronger and provides a transformation to the Medicare program to make it more focused on helping seniors improve their health, get focus on prevention, focus on wellness, and makes many important changes to the program. For example, the law closes the donut hole for the Part D drug benefit over the next 10 years. The law provides free cost sharing for preventive benefits that are covered by Medicare. The law will extend the life of the Medicare Trust Fund, and it's our strong belief that this law will help help improve the Medicare program to make it stronger for this year, but for many years to come.
Well, we haven't even gotten to our questions yet, and you've hit on some very key points that people are really looking forward to hearing from us. Jennie, AARP. Now, you're probably getting inundated with questions. Let us know what's on top of mind. What are some of the major concerns?
Well, I think because our population at AARP ranges from the age of 50 on to 100, we have basically a split in the population age-wise of people who are under 65 and then over 65 with the Medicare question. So some of their questions are a little bit different, and they actually cover a couple of the areas, certainly, that John's already brought up, along with Kathy, thinking about what's going to be the difference. And I think most people are especially worried, what does this mean to me? And that's something that I think in the course of our discussion we hope to cover a little bit more.
Well, that's a perfect segue, because I think that's what we're here to do. What does this mean to our audience? And with that, I'd really like to get started and spend the remainder of this program taking the questions that we've received. We've received over 1,000 questions for this web chat alone, and we're trying to get through as many of those as possible. We may have to paraphrase them a bit, but we're going to try, and we're going to go with our first question, which is going to Jennie. This is from Sarah from Colorado. There's a lot of information out there for those age 55 to 64. What are the benefits for those over 65?
Well, I think that John started with that. I think one of the biggest areas that we always hear about is the worry about the prescription drug benefit when people fall into this coverage gap, and then commonly called the donut hole. And I think, as John mentioned, the ability to start closing that gap, because what happens to many people who are over 65 and take medications, when they hit this gap, when they have to pay fully themselves, people oftentimes may not take their medications because they can't afford it. So one of the great things we've been able to promulgate, because CMS will make sure that happens, is that for people who happen to fall into that gap right now, they will get an automatic $250 check that will be issued. And one of the things AARP really wants to emphasize, this is something they don't have to fill out forms, talk to anybody, over the phone about it, unless it's their normal provider, because we're concerned about fraud. I mean, that's the other thing that we make sure that a lot of our members know.
Well, I think that's a great point, and I think that's something that we receive a lot of questions about, so thank you for that clarification. And I'm going to now to Irene from Massachusetts. How will the new health reform affect prescription drug coverage, especially as regarding to the donut hole? John, can you give us a little insight on that?
Well, the law takes a 10-year approach to ensuring that the donut hole is closed over time. And so this year, starting in 2010, any senior that hits the donut hole or has drugs that fall into that coverage gap will receive an automatic $250 check. Those checks will start being issued on June 15th and will continue throughout the year as beneficiaries hit the donut hole through this year, 2010. Starting next year, in 2011, brand name drug manufacturers will go into agreements with CMS to offer a 50% discount for drugs that are provided in that donut hole. Then the third way is, over time, the benefit parameters will come together over a 10-year period to ensure that beneficiaries have complete coverage by the end of the 10-year transition.
Well, that's great, but Irene has a good follow-up question. She specifically wants to know, this is a good one, all of these forms, everything that we're filling out, will they be available in large print for folks who are visually impaired?
Yes, CMS makes sure that our materials are provided in different languages, are provided in large print. We have a wonderful website, Medicare.gov, that provides many of these materials. We have a 1-800 toll-free number. Kathy has tremendous resources in her agency, and we make every effort to make sure that these materials are available to all beneficiaries in all forms.
Well, I appreciate that, and I think, Kathy, we're going to good segue from you. We have a question from Bob from Florida here. Is the annual election period changing this year? When is the new annual election period for Medicare?
There are no changes to the annual election period, which we also call the enrollment period, this year or next year. Seniors have become familiar with this election period since we had the Medicare Part D, the prescription drug coverage. And they're used to, at the end of the year, between November 15th and December 31st, looking to see whether or not they want to select a new prescription drug plan. That will be the same this year, the same time frame in 2010, the same time frame in 2011. In 2012, there will be a period for them to make this decision, but it'll happen a little earlier. So starting 2012, their enrollment period, their election period, is from October 15th to December 7th. So they will still have plenty of time to make a decision, but won't run up against the end of the year and get into all the various holidays and really a rush to make a decision right before the 1st. This will give people plenty of time to shop and make good decisions.
Great.
And CMS heard a lot of concerns in the past couple of years about having to make this choice during the holiday season, and so the intent of this change, as Kathy talked about, is to make sure that seniors have sufficient time, they have sufficient information, but don't have to rush at the end of the year to choose a health plan that best suits their needs.
Well, I think that's very helpful, and it also gives senior the opportunity to focus on other things like holiday gifts for their grandkids. Sure. Jenny, this is coming in from Alan. Here's a question for you. Since I retired in May 2009 and don't belong to an employer insurance program, will I be able to qualify and benefit from the health reform bill that was recently passed? If so, what would I do to qualify, and what must I do?
Well, this is a really specific question with somebody who has retired and may still have coverage. And right now, if somebody still has coverage, that is maintained. It's really geared for, there's a whole nother development with a risk pool that has been identified for people who don't have coverage temporarily. But the impact probably of some of the legislation doesn't happen until later on, say in the year 2014, when more of the broader population has choices of different exchanges. So I would say there probably is a longer range impact for somebody like him who is already a retiree. If I could go back for a moment, you asked me a question earlier about just for the person who's over 65, and I brought up the donut hole that is such a big part of it. But one of the things that has come about from the legislation is the amount of prevention now that I think John alluded to with no cost sharing. And one way that we bring it up is that now you can go and get a mammogram, or to have your colon checked. These are kinds of tests that in the past people used to have to pay for. And in order to make sure that everybody has these prevention benefits, which help with our well-being in the long run, our ability to have that as part of the benefit is new for people who are 65 and older. And then finally, because it turns out that many people who are over 65, say about 1 in 5 people over 65, might go to a hospital over the course of a year, which is not unusual. There are benefits now to help coordinate care, so that's something that will make a big difference because it's very choppy sometimes when people leave a hospital, and that is a new area that is going to be, I think, a real asset for people over 65.
Well, I mean, thank you for that insight. It certainly does add to what we've been talking about beforehand. Kathy, I have a question from you from Karen from Kansas. We're hearing about scams that are continuing to spread around the country that are preying on vulnerable people, such as seniors. What do you hear, and what can we do about it?
We have become increasingly more concerned about possible scams. I think the best place to start is to talk about what seniors can expect in terms of time frame. People on Medicare who are following this conversation want to know, what do I need to do right now? And when do I have to make more decisions? This is not a time frame right now where people need to make a decision at all. In the fall, as they always do, seniors will get information from CMS about what their options are and their choices are. Between now and then, CMS will be sending out a $250 check for people who've reached the coverage gap. Because of that time frame, we find that seniors are being scammed right now in a couple of different ways. There are incidences of individuals going door to door and saying things to seniors that are simply not true. So these are what seniors should watch out for. There's nothing called Obamacare. It's not a federal program. It's a line that's been used publicly, but it's not a federal program. The federal government never sells insurance door to door. So if someone comes to a senior store and says, I'm from the federal government, I'm here to sell insurance, that's just not true. The other thing is that for seniors who get the $250, they don't need to do anything, they don't need to send any information to CMS, and they certainly don't need to provide their bank account number because that's what we hear is happening. We have a network of volunteers around the country called Senior Medicare Patrol, where we train seniors to help each other, to read their statements, to find out if there's questions, who to call. And it was through our Senior Medicare Patrol in Missouri that we first learned that salesmen were going door to door. And I've now heard from 7 other states where this is happening. If people wonder, is this person legitimate, there are several things they can do to help themselves. They can contact their insurance department in their state to find out if this person is selling for a real company. They can talk to the Attorney General in their state. Secretary Sebelius has sent letters to all of the Attorney Generals and all of the insurance departments warning them about this scam. The other thing seniors need to know is they have time to make decisions. Like we were talking about on their open enrollment, the federal government gives you 6 or 7 weeks. You should never have to make a decision at your kitchen table or on your doorstep about your health benefits and your Medicare or Medicare supplement benefits. There are real people who go door to door, but the people who are right now saying they're from the government are simply scam artists who are preying upon seniors.
If we can just have a quick follow-up for those seniors who are watching who want to join, who want to be part of this patrol, what can they do and how can they become involved?
They could go to our website at AOA.gov and we can give them information about the Senior Medicare Patrol. And there are volunteers in every state. They can contact the Senior Health Insurance Program, the Senior Medicare Patrol. The local area agency can help them find that. But the best resource is to come to our website at AOA.gov and we can get them directed.
Well,
We've got 5,000 volunteers out there who are ready to help.
Well, we hope we can get more.
And Louise, if I could jump on that, I think that we know that Kathy is actually tomorrow having a chance to speak to all of our state directors, our 50 states and our 3 territories. And the ability to help recruit volunteers is something that, we certainly offer our partnership. We have a whole effort of structured volunteerism called Create the Good. And in that process, this is one of those examples where we really could help our communities to make sure that seniors are protected from these scams.
Thank you. Well, we're going to take a question we have a Twitter question. This is from Judy, and it's going to John. Someone told me that Medicare Advantage plans will be gone by 2014. Is that true?
That is simply not true. It is true that the law makes changes to how CMS pays for these plans, and there has been long concerns that the payments that the program was required to pay were excessive, and Congress took steps to reduce those payments. But we believe very strongly that seniors will continue this year, next year, and in the future will have choices, we'll have good choices, we'll have strong choices, and they can still continue to always choose to receive their benefits from the traditional fee-for-service Medicare program. They will also have private plan options. In addition, the law requires CMS for the first time to pay plans bonus payments for those plans that have the highest quality scores. We're going to be helping beneficiaries understand which plans have the highest quality scores, but as important, we're going to be providing a financial incentive for plans to improve their quality, to enhance their performance, which to me creates the best possible program for Medicare beneficiaries.
Great, thank you. We have a second question from Twitter, and that is going to Jenny, and it's from San Francisco. I'm 59 years old, have no insurance through my employer, cannot afford health care, yet I'm probably over the low-income bar. What's in store for me?
Well, I think this is something that maybe John can also help with. For people who are in that kind of space right now with no coverage, I think there are going to be some opportunities to start having the option to join this high-risk pool, which is kind of a temporary measure before all the exchanges that will be developed by 2014 are going to be available to everyone. So, John, I wonder if you have some more specifics on that one.
Sure, that is true. That by 2014, we will have a system of state insurance exchanges to ensure that everyone has the option to purchase affordable coverage. But in that interim period, the law takes several steps to provide some temporary programs to help folks that fall into to these gaps in coverage. One of which is that this year the law requires HHS to provide funding to states to expand or create new high-risk pools. So for those individuals who have chronic conditions that can't find coverage today, we'll have more opportunity to find coverage through a state high-risk pool.
Could I jump in, Louise? One of the things about health reform that's so good is it takes parts of the system that are working well and sometimes provides more support and better support. High-risk pools are not new. There are some states, I come from Kansas, we had a high-risk pool, and they were always an option for people who couldn't shop in the market and afford the prices. What health reform has done is provided federal support to make sure that every state has a high-risk pool, that it's financially sound, and if the state doesn't have a high-risk pool, then the federal government will provide assistance. So the best thing for people to do state by state is talk to their local state insurance department, call us at the federal government, look at the health reform information, and we can help direct them to where they can go in their own state, because every state will be able to provide this solution for their individuals who are not quite there for Medicare yet.
Well, I hope this really helps a lot of the folks out there, because we did receive multiple questions on that, so that was a pretty good answer. Thank you all. We're moving on to Ronald from Colorado, and this is going to you, John. Popular in the case. The new health care program is very confusing to me. From what I understand, if I have a Medicare Advantage program, I can expect both premiums and co-payments to increase while receiving less coverage by 2012. Is that correct?
Well, I think the best answer that we can give today is that changes to plans happen every year. Premiums change, co-payments change, and that has happened in the past, and that could happen in the future. What we believe very strongly is that the law will encourage plans to provide better quality to their enrollees, and that seniors will continue to have many strong plan options from which to choose this year, next year, and into the future. CMS encourages all Medicare beneficiaries to always, each year, compare their plan choices to understand the changes in cost sharing or premiums, and health reform doesn't change that process that all beneficiaries should go through every year. So we encourage beneficiaries to make the best possible choice each fall. As they change, their plans change, and CMS and our partners provide lots of resources to help beneficiaries understand the best possible options for them and what's the best plan for them to choose.
Great.
If I could add to that, that is a question sometimes that we get, but one of the things we always emphasize, and especially even before the reform passed, was there's a protection of the traditional Medicare benefits. And so implicit, no matter, that's one of the things that doesn't change for people, because people are thinking that so much does alter. But everybody will have that same core baseline that has been established since 1965 as to what their benefits are. So that's an area we want to reassure people that is definitely still at the core. But no matter whether you're in a what they call a fee-for-service plan or the Medicare Advantage plan.
Yep, that's a good point. And the traditional fee-for-service program will be as strong as ever. The law will extend the life of the trust fund that pays both the traditional fee-for-service program and also the private plan options. The law adds new benefits and really seeks to transform the program to focus on wellness, to focus on health, to ensure that it provides the best possible health benefits to Medicare beneficiaries. And the traditional fee-for-service program will be stronger than ever this year and into the future.
Well, that brings us to our next question from Sharon, and this is going to you, Kathy. I read there's funding for programs to help with counseling and assistance. When will that happen, and how can you apply?
We have a wonderful network of providers who provide direct assistance, who specialize in answering, frankly, all the kinds of questions that we've had today. This partnership exists because of funding through CMS, working directly with aging network providers, area agencies, aging and disability resource centers, and others around the country who can provide help. It's a good way to think of them when you think of the people you call at the end of the year when you're trying to make a decision about your prescription drug coverage. Those are the same people, the senior health insurance programs, who will be available to help this fall when seniors have new choices to make. That's wonderful funding. It comes from CMS, and we expect to be able to provide additional support for this network by the end of September so that they'll be geared up and ready to go when the fall enrollment period starts.
And that's September?
The end of September of this year, yes.
That's great.
More money, health reform has made more money available for that network. They're critical and certainly demonstrated their value as we move forward with a prescription drug coverage that was new to the nation, and this is new to the nation. We need to go to the same resource. It's a trusted resource for information for seniors.
Great. Well, our next question is from Madeline from Washington State, and she's asking, who exactly will be eligible for coverage in the early retiree insurance program? Will all early retirees, including those with and without health problems? John?
Well, I think it's important to note that the early retiree reinsurance program is a program that's designed to support company-provided benefits and to ensure that payments that co-payments, premiums are always affordable. So an individual won't have to apply for this program, but their company sponsor that offers retiree coverage will apply to receive additional financial support to ensure that premiums, co-payments stay affordable for beneficiaries who are in these plans.
Great, thanks. We have two additional Twitter questions. Here is one from D. Bell. Under the new health care bill, Medicare will begin paying for annual wellness exams. When will this new benefit begin to be offered? John?
Those benefits will start in January 1st, 2011. So the tradition for adding new Medicare benefits generally happens at the start of the calendar year. So the annual wellness visit, the free cost sharing for preventive benefits that are covered by Medicare, all of those will begin to happen starting January 1st, 2011.
Great. Jenny, I have a question from Nick here. What does this law mean for in-home services funded by Medicaid, Medicare?
Well, one of the big areas that we oftentimes think about in Medicare or in state Medicaid services is more the health and the medical services. But most of us really have our lives living in our homes. One of the things that is a real positive improvement is an increased focus on the fact that more home and community-based services are available. You know, they're always going to be available, say, nursing homes when you really need that degree of care. But most people have other degrees of need along the way. So the legislation actually supports more development in that particular area. And also, one of the things that I think has been interesting is oftentimes when people end up going to a nursing home, the spouse who is left at home oftentimes in the past used to have to spend down their personal funds for the other spouse. And but when they had in a nursing home, they were able to protect that from spousal impoverishment is what it's called. The new law actually allows for protecting spouses who have these community-based services much more. So that's going to be a shift. Again, help people's income be more stable, because it's about not only the medical and the health care, it's the money that you need to live on, and that will help tremendously.
Well, I think you're right. I mean, that's something that many people are concerned about, so very helpful. And I do have a follow-up question for you, and this is coming from Steve from New Jersey. With more people getting access to care, will that make it more difficult to find a primary care physician?
Well, one of the things that the new law does is actually make sure that primary care physicians are paid more and have an incentive really to continue to serve and grow this. So there's a 10% additional payment now for primary care physicians, including geriatricians, who are physicians in particular who specialize on the care of older individuals. And there is also new tremendous funding to invest in greater training of people who are going to go into these fields of both primary care and specializing in aging services, both for physicians and nurse practitioners and physician assistants. And I think finally, in the legislation is a whole effort to have a workforce commission that focuses on health provision to really take a look at it, because you hear about concerns about future shortages of physicians and nurses and social workers and pharmacists. So that will be an important effort to make sure the country is going to be well equipped with the workforce that will be needed.
Great, thank you. John, Richard is asking, how does an early retiree get insurance benefits for his children?
Well, I think a couple things that the law changes over the next couple of years. But starting this year, those individuals who are age 26 or younger have the right to stay on their parents' health insurance plan. Previously, those age requirements were 21. We expect that the other reforms that happen very quickly will also lower the price of individual insurance that's sold through the individual market. And then by 2014, health insurance options will be available throughout the country in all states, and we'll have affordable options. So there's some upfront benefits that will happen very quickly to help more younger individuals, but then over time be more benefits offered to all individuals across the country.
Well, I think that's a great way to close. I know we're running out of time here, and we've gone through a lot of questions, and the information that you've all had a chance to discuss today I think is very helpful, especially for everyone who's looking. So we thank you very much for being guests today, and we certainly appreciate it. That's all the time we've got today, so let me thank our guests once again: Kathy Greenlee, the Assistant Secretary for Aging at HHS, Jonathan Blum, the Deputy Administrator and Director of the Center for Medicare at the Centers for Medicare and Medicaid at HHS, and Jennie Hansen, the President of AARP. We hope you've had some of your questions answered during this webcast. We're making it available on demand soon, and eventually will be able to be archived as a webcast. You can find it at www.healthreform.gov, and we hope you'll browse this site to find other information specific to your needs. Next week, we'll be discussing some of the facets regarding insurance companies, and I expect we'll have quite a few questions for our guests. I'm Luis Rosero. We'll see you next time.